Palpitations may be a sign of rhythm disturbances of the heart. Patients can complain of symptoms related to a rapid heartbeat, or potentially non-sustained palpitations of shorter duration may be a reflection of extra heartbeats, ectopic beats. Palpitations may be caused by a heart rhythm disturbance where the heart rate is faster than it should be. Rhythm disturbances can come from either problems in the top chambers, the collecting chambers, the atria of the heart, or from the ventricles, the bottom pumping chambers of the heart. Well, palpitations are very common. Often palpitations can be relatively benign, and if the palpitations are relatively short and not associated with any other symptoms, perhaps chest pain or breathlessness, there's usually no urgency in terms of seeking attention. But if the palpitations are associated with dizziness, a sensation that the patient might black out, severe breathlessness or chest pain, or if they're very prolonged, then a more urgent assessment is usually required. Well, the treatment needs to very, very specifically target the underlying cause. And there's a whole range of different heart rhythm disturbances that can be responsible for palpitations. So the key aspect of the assessment is making a recording of the ECG at the time of the palpitations. Once an ECG recording can be made corresponding with the palpitation event, then we can make a more specific diagnosis, and that specific diagnosis then leads to more effective treatment. It depends enormously on the specific heart rhythm that's identified at the time of the palpitations. A common rhythm disturbance that we see will be atrial fibrillation. Atrial fibrillation can be related to a variety of different lifestyle factors as well as underlying structural heart disease. Sometimes palpitations can be due to an awareness of a normal heartbeat just running more rapidly, or ectopic beats, where there's additional beats superimposed upon the normal heart rhythm. Common factors aggravating those would be alcohol in excess or a lot of caffeine.